Let me tell you a little bit about this next patient. This is a patient who's 37 years old. It's a woman who I've been following since 2006. She has a blockage in the left arm artery. Right now we realize that even the textbooks can't even keep up with the techniques that we're trying to educate people with.
The ability to put specific topics on demand and not have to listen to 5 or 6 other procedures you're not interested in is just amazing. I'm a big believer in this. I think Ask the Specialist will be huge.
The Ask the Specialist production team would like to thank everyone for their written and videotaped submissions. The production department works very hard to review every submission in a timely manner and will be contacting you if you have been chosen to participate in the talent portion of this program. It is our pleasure to acquaint you with our production team and the experience we have working in a medical environment. Our field team travels with 2 members, the producer and the director of photography. They are television industry veterans with extensive experience in a hospital setting. The executive producer of Ask the Specialist is Cassie Burgess. She taped her first medical show over 20 years ago and has spent 10 years as a production news director for ABC and NBC. Cassie knows the elements needed to best tell your story. The photographer and creative director is Neal Pruitt. Neal filmed his first medical operation over 25 years ago. As a feature producer and director for Turner Broadcasting and others, Neal has learned how to keep people's interest piqued. Our team of professionals have traveled the country to capture the best surgeons in their element.
We are just so happy and we feel privileged, frankly, to have the film crew here for a whole week. I feel spoiled. I really believe that this is the wave of the future, along with the internet. This and the internet go hand in hand.
Knowledge of HIPAA rules, combined with the experience in operating rooms, catheterization labs, and medical office settings, we understand the importance of patient privacy. Where the need for sterile field is observed, the photographer is the only member of the team that will be in the operating room. As always, patient safety is our #1 priority.
There are rules and regulations in operating rooms that include sterility. If you actually violate that distance, that can compromise the procedure and the patient safety.
Footage we capture on location can be provided to both the affiliated hospital and the specialist being highlighted. This provides the ability for self-promotion with full high-definition quality.
Thanks for watching Ask the Specialist. This is Dr. Mustafa.
If you have been chosen to appear on camera, a production plan will begin with our producer, your office staff, and the affiliated hospitals. This is the first step in the production process and takes the most time, so please be patient.
Cassie was particularly interested in my background with philanthropic medicine, with my career here in the Beverly Hills, Hollywood area and treating high maintenance patients in a very competitive atmosphere. And at the same time, my work in government. I served as a White House Fellow in the Clinton administration, and this intrigued her.
Vision Broadcast Network looks forward to promoting your field of interest and educating our viewing audience. For the Ask the Specialist production team, I'm Neal Pruitt.